Did you know that there is a type of green vegetable praised as a superfood because it contains a host of nutrients beneficial for the brain, cardiovascular system, immune system, and even eyesight? This vegetable is spinach, also known as spinach greens, pollock, or monk's vegetable. In traditional medicine, this vegetable also has elegant names like lingzi herb, huangyang herb, or evergreen pine, belonging to the amaranth family. However, the very vegetable considered a savior for many organs also carries serious health risks, especially for the kidneys, digestive system, and people taking blood-thinning medications. Let's explore more with the channel Everyday Life about the wonderful benefits as well as the potential harms of this vegetable, so you can use it reasonably, scientifically, and in the best way for your and your family's health. Spinach, the bright star in the world of green vegetables. Spinach prefers cool climates, so in Vietnam, this vegetable is most commonly grown in Dalat, where natural conditions are ideal. In just 100 grams of spinach, you can absorb 28.1 milligrams of vitamin C, equivalent to 34% of the daily requirement. Plenty of plant protein, which helps build muscles. Calcium, iron, magnesium, potassium. Important vitamins such as A, K-thiamine, fiber, phosphorus especially. Its low-calorie but nutrient-rich content makes spinach a top choice for those following a healthy diet, weight loss, or vegetarian diet. Outstanding benefits of spinach. 1. Good for the heart and brain. The iron, magnesium, and folate content in spinach is essential for blood formation and central nervous system function. Iron helps transport oxygen to the brain and heart muscles, thereby improving concentration and reducing fatigue. Additionally, vitamin K in spinach supports preventing arterial calcification, helping to prevent atherosclerosis and coronary artery problems. 2. Boosts immunity. Vitamin C, A, E, and antioxidants in spinach help enhance immunity, fighting against attacks from bacteria, viruses, and free radicals, factors contributing to cancer and aging. 3. Prevents osteoporosis. Although spinach contains oxalates that hinder calcium absorption, which we will discuss in detail later, it is rich in vitamin K, a nutrient that helps increase bone density and effectively prevent osteoporosis. 4. Improves digestion. Fiber in spinach helps enhance bowel movement, supports excretion, thereby reducing the risk of constipation, bloating, and helps lower blood cholesterol through binding with bile acids. But be careful. Spinach is also a double-edged sword. Despite its benefits, spinach carries many health risks if consumed improperly or excessively over a long period. Here are some dangers to pay special attention to. 1. Causes kidney stones, the biggest risk. Spinach contains a very high amount of oxalates, which combine with calcium in the body to form calcium oxalate crystals, one of the main components causing kidney stones. Studies show that eating a lot of spinach daily over a long time significantly increases the risk of kidney stone formation, especially in people with a history of kidney disease, low water intake, or a diet high in animal protein. Advice: if you are at risk of kidney stones, limit spinach consumption to no more than 1 to 2 times per week, and drink plenty of water throughout the day to support kidney function. 2. Reduces calcium absorption. Not only causing kidney stones, oxalates in spinach also hinder the body's absorption of calcium from other foods. If you often eat spinach together with calcium-rich foods like milk, seafood, or tofu, the calcium in the food will be locked and cannot enter the bloodstream. The long-term consequence is calcium deficiency, causing brittle bones and osteoporosis, especially in the elderly. Advice: do not eat spinach at the same time as calcium supplements. Separate meals or eat them at least a few hours apart. 3. Causes bloating, indigestion, digestive disorders. Although fiber is beneficial for digestion, consuming too much, such as eating spinach too frequently, can cause adverse effects. Bloating, indigestion, feeling gassy, disrupted bowel movements, diarrhea. The high insoluble fiber content in spinach puts great pressure on the digestive system, especially in people with stomach or colon problems. Advice: cook spinach thoroughly to soften the fiber and make it easier to digest. People with sensitive stomachs should limit eating it raw or in smoothies. 4. Interferes with the effect of blood-thinning drugs. Vitamin K plays a role in blood clotting, so if you are taking blood thinners like warfarin, eating too much spinach can reduce the effectiveness of the medication and increase the risk of blood clots. Advice: there is no need to completely avoid vitamin K, but you should maintain a stable intake and consult your doctor if you are being treated for cardiovascular disease, thrombosis, stroke, etc. 5. Causes allergies in some people. Although rare, some people may be allergic to spinach, with symptoms such as itching in the mouth and throat, hives, redness, nausea, dizziness, difficulty breathing, anaphylactic shock, severe cases. Advice: if you experience any abnormal symptoms after eating spinach, stop eating immediately and see a doctor to determine if you have an allergy. 6. May worsen gout. Spinach contains purines, compounds that break down to produce uric acid, a main factor in causing gout. Although some studies suggest that purines from vegetables do not affect as much as those from red meat and organ meats, people with gout still need to control their spinach intake. Advice: if you have gout or high uric acid levels, limit spinach consumption and consult your doctor about an appropriate diet. So how should you eat spinach to be good for your health? Spinach is a wonderful food if used correctly, reasonably, and without overuse. Here are some safe suggestions. Eat 1 to 2 times per week, not continuously every day. Cook thoroughly instead of eating raw or in smoothies, to reduce oxalates and insoluble fiber. Do not eat at the same time as calcium-rich foods. Avoid eating too much if you have a history of kidney stones, gout, or are taking blood thinners. Follow your doctor's recommendations if you belong to a risk group. Spinach, a small vegetable, contains a nutritional power that cannot be underestimated. It can be a hero helping you improve health and prevent diseases if used properly. But if eaten incorrectly, spinach can also become a silent enemy to your kidneys, digestion, bones, and medications you are taking. Always listen to your body, eat a balanced diet, and remember, anything in excess can become harmful. If you find this article useful, don't forget to share, subscribe to the channel Everyday Life, and leave a comment about your experience with spinach. Wishing you good health and a happy life every day.